waiting room? Great, thank you, Chief Gagne.
All right, welcome everybody and good morning. Thanks for joining us today. My name is Scott Gagne. I am the PIO for the York County Incident Management Team that's operating under the COVID-19 Immunization Action Plan. This morning we hope to give you some information and update on where we are regarding our status in the operation with trying to get the first responders that are EMS licensed in our county vaccinated. You're going to hear from different members of our command staff, and in the end, we'll allow for some follow-up time for questioning. Due to the sensitivity of some of the things we're going to talk about and the complexity of this, please understand we're going to do our best to answer most of your questions. If there are a few that we can't due to the nature of them, I hope that you understand that. We're looking for your help. This is definitely a complicated process. We can't do it alone, so we're looking for help through this. We believe in a strong partnership between our organization and the media, and we know that in order to be successful, we're going to need you to help us and work together as a team. I'd like to introduce some of the people that are on the call with us. Of course, I'm not sure how you're looking at things compared to me with the Hollywood of squares, but so Chief Nathan Schools is our incident commander. He's up to my right on my screen anyways. And then Chief Steve Bonatti is our operations section chief. Chief Roger Hooper is our logistics section chief. And then Megan Arsenal is our deputy PIO, and she works for York County EMA. So at this time, I'm going to turn things over to our incident commander, Chief Nathan Schools.
Good morning, everyone. Thank you for jumping on. Thank you, Chief Gagne, for the introduction. My intent here is to give you folks the sort of the 10,000-foot view of what's going on right now, and then I'll pass the mic to Chief Bonatti, who's our operations chief, and then further down the line. So a couple of things. Or the biggest thing here that we set as the guiding principle under the York County Incident Management Team was first to assist the 3 departments in York County that were earmarked to receive vaccine. Those were Kennebunk, Old Orchard Beach, and Sanford. And we were going to ensure the safe and effective, timely deployment of the vaccine to our first responders in York County with no waste of vaccine. We all know that the vaccine is the commodity here, and that has been our guiding principle from day one. So just to give you a little bit of an idea of what the incident management team in York County looks like, it's all grouped together under York County Emergency Management, under the direction of Director Art Cleaves. And it's built with fire and EMS chiefs, police chiefs, York County Emergency Management staff, medical direction from a doctor here in the county, and regional school unit resources. So this is a big team effort from lots of different backgrounds. The goal here is to immunize first responders that were identified in the phase 1A of folks, first responders to be immunized. I think it's important to note that we didn't make the phases, that we are just following the direction from the CDC, from Maine EMS, and people upstream. We are just a player. The first immunization in York County, as most of you know, was given on the 23rd of December in Old Orchard Beach. Old Orchard was the first department in the county to receive their first batch of 100 vaccine. That was our beta test site. It was all grouped under our operations section. And that was the spot where we learned a lot about good flow, our ability to mass vaccinate folks so that people aren't waiting. We also need to make sure that during these times, we don't have lots of first responders in one spot at the same time, because really we need to make sure that we're not spreading the coronavirus or COVID-19. So there's lots of things that we have to put in play there. Screening of people as they show up to make sure they're not showing signs or symptoms. and then getting them through. To date, the departments in York County have received 400 doses, and roughly half of those have been or will be deployed in the next couple of days. We have goals of how we'll deploy the remainder within the week. I would just say that I don't want to take the thunder from the operations section, but we do have some scheduled events that are coming up for first responders. We're not going to be able to share all of the information, but we will be able to share minimal information on how we're going to roll that process out. And I'll just say that the success of this team is just the work that everybody is willing to put in. The EMS providers have been in ambulances on the streets working throughout this pandemic. And we're really happy to come together and put a positive spin and impact our communities in the right way, instead of the way that we have been for the last 9 months in the response. So we're happy to hopefully start to put an end to this. So that's the 10,000 foot view as we see it. I'd like to pass this on to Chief Bonatti, our operations section chief, for a briefing from ops.
Thank you, Chief Schools. Again, my name is Steve Bonatti. I'm the operations section chief for the whole county deployment of this vaccine as we've built up through the York County EMA IMT team. So just to bring you up to speed a little bit, we have done in just a week, we have done close to 170 vaccinations of frontline EMS personnel. We had the vaccine was a little slow to come into us initially. We hope by the end of this week, through the clinics we're running this week, we will have close to 400 people vaccinated within the state between the end of this week and the beginning of next week. As you all know, the vaccine is a rare commodity. We take what we can get from Maine CDC. We have no say in how much we get. But this team has been very well trained and stood up to deliver it as fast as we can get it within reason. So we have plans in place, very dedicated people on each of the 3 teams to make sure that everybody in the EMS world within York County can get this vaccine as soon as possible. The logistics are quite complex, and Rod has done a great job on doing that. But the 3 towns, Sanford, Kennebunk, and Old Orchard, have become the caretakers of the vaccine. We receive the shipments. We have formulated teams to be trained and deploy the vaccine to anybody in the EMS license world within York County that wants it. And with that, we have also had the good guidance of Dr. Schmitz from Southern Maine Healthcare, who has helped give us those technical aspects that we need and worked with the teams to make sure things go off smoothly as well. We hope, and I say it's a hope, that if the supply stays consistent for us, we can have all of our EMS people within the county vaccinated within probably 2 weeks from today. So that being said, we are purely at the mercy of the CDC and those allotments, and we hope that they keep coming as long as we can, because the sooner we get our people done, the sooner we can get other people done, like the remaining firefighters, police officers, and as soon as we can get them done, we can get more people done in the nursing homes, and not necessarily our teams, but that those allotments of vaccine can be redistributed to the places that need them the most. And it's really important. Our people have been on the front lines now for over 10 months, dealing with COVID patients daily. And because we are on the front lines, we believe that this is a good place to start to get, as caretakers that deliver service to your communities each and every day, the proper protection that we need so we can continue to protect you people as time goes forward. So with that, at the end of this, after I hand this over to Rod, I'll be happy to answer any questions from you at the end of the initial introductions. So thank you. Go ahead, Rod.
Good morning. My name's Roger Hooper. I'm the fire liaison at York County EMA, and my role in the incident management team has been that of the logistics section chief, which means I've got to find the things that our operations teams need to execute their mission. So we've split the county up into 3 regions, and we put logistics people from my group out there to support the operational teams, and we've reached out to try to locate facilities where we can hold vaccination clinics, as well as the staff and equipment that may go along with that, and just so we can have facilities set up and ready to go. So then the vaccination teams can just come into place, and we can efficiently and smoothly and quickly get our folks vaccinated. As I think it's already been said, we've been focusing on the priority 1A people, which are licensed EMS providers, and that priority 1A is determined by the CDC. And the communities within the county have stepped up to support this. The school, particularly RSU 6, has been a key player in facilities and some equipment. And we're looking at other school systems and other municipal buildings around the county to do the clinics in. Another piece that has been challenging is trying to determine a number. So we have a lot of individuals in this county may work for several agencies. We staff a lot on a per diem basis around this county. So making sure that we haven't duplicated individuals has been a challenge to keep that target number as accurate as we can. And we've had a lot of support and assistance from individual agencies to make sure that we can really tighten that number down. So I think we made a lot of progress in that area. There's been a lot of work gone into this. There's a lot of people that have stepped up to help us with this. And this is truly a community effort throughout York County to pull this off. And it's pretty interesting to know, this is a historic event. No time in the history of our state or our country or the world has this kind of an immunization project taken off. And it's great to see folks come together to get this done, and it's definitely a necessity, so we can hopefully get things back to some sort of normal here in the near future. Chief Schools, that's it.
I will pass it back to Chief Gagne.
Thanks. All right, so I guess we'll open some things up for questions. I'm sure that some of you have some preset questions ahead of time. Megan can see. Megan, is it best just to raise hands within Zoom? Is that what you'd like to see?
Sure.
All right, so I'll let Megan coordinate everything. So if you guys want to go ahead with your questions at this time, that'd be great, please.
Mel Meyer, go ahead.
Yeah, you mentioned at the end trying to figure out exactly how many people are still needing to be vaccinated. Have you determined that full number? I know that at one point it was said like 400. How many more people still have to get their first vaccinations?
Steve, do you have the most concrete numbers on that?
So going back to what Chief Hooper said, chasing down a concrete number in York County has been hard, but right now our best guesstimate is we have about 450 providers that we have to account for. So we hope to have, like I said, by the end of next week, at least 400 done, and the 50 remaining will be those stragglers that we have to chase a little bit to get taken care of. And of course, some people have chosen not to take the vaccine, and that's their personal right to do so. So not every EMS provider in the state of Maine will be vaccinated, but everyone has been given the opportunity for the vaccination. So it's their personal choice should they not take it.
I guess a follow-up to that, if you are having issues with people deciding that they don't want to get vaccinated at this time, what concerns does that pose from an EMS standpoint? I'm thinking of living in close quarters and fire departments and things of that nature. What concerns does that pose then?
Well, it's always a concern, and it's not going to change the way we've been doing business for the last 10 months. I mean, most fire stations and EMS facilities, the groups have been working, trying to social distance within the fire stations as best they can. Everybody's usually wearing a mask, that sort of thing. It does bring the opportunity for sickness to come back to the fire station. And we put that emphasis on those employees, knowing that by doing this, you are putting yourself and the rest of your crew at risk by not taking the vaccination. I think most people heeded that warning. I don't think we're going to have a high percentage of people that don't take it, but there are some people that have chosen not to take it. And so we put as many safeties in as we can within the individual stations. And we're going to continue to carry those safeties through until we get to a point in this country, in our lives, that we can let our guard down a little bit. But that's going to be quite a ways down the road, because we have a long way to go before everybody has the opportunity in this country to have that sort of protection.
Thank you.
All right, next we'll hear from Rosalind Flaherty.
Megan, before we go there, can I just jump in? Mel, what I want to sort of highlight is one of the things that we have to deal with across this state. And one of the reasons why it's been so very difficult to track how many people or how many of the 1A first responders, licensed EMS providers there are in the county is because in lots of cases, one licensed EMS provider who works in York County may work in 3 to 4 to 5 different agencies. So we just can't take the amount of employees for each department and send that through. So that has been a logistical undertaking that just we continue to move the ball forward. So I'm not sure if that was part of what you were asking, but we're just trying to make sure that each EMS provider, regardless of their employment, it has the opportunity to either receive or decline the vaccine.
Thank you. Go ahead, Rosalind.
Hi, it's Rosalind from Channel 6 News Center, Maine. Have you guys come up with a plan for the second round of doses and how you plan to administer those?
So thank you, Rosalind, for the question. So we have been guaranteed from Maine CDC that for every first dose that goes out, there is already a second dose allotted for the individuals that have received it. So as we vaccinate the people, they are given a card with a lot amount, the lot number that they got this on from the CDC of what the vaccine lot number is, but it also has the date on it from when they received their first shot. We have worked heavily with the individual service chiefs to put the emphasis on their people that once they take the first shot, they have to be available 28 days later to get the second shot. And some of that has become a little bit of a logistics nightmare because some people were okay on the first date, but on 28 days later, they may be tied up working and they can't get out of work. So we are making accommodations to work with those specific individuals as best we can. But for the most part, everybody knows that the first date is ironclad as well as the second date, and they need to show up because we do not want to waste any vaccine on somebody who cannot complete the vaccination process, because it's important that every drop of vaccine in this country be used appropriately. And if we can't use it, move it on down the road to somebody who can use it.
Next, Patty White from Maine Public. Go ahead.
Hi, thanks very much. You said in your press releases that you've been getting a lot of inquiries from the general public about vaccinations, and you're asking people to sort of hold off on asking about them. I was just curious, how many of those calls are you getting? And when the vaccine is available to the general public, do you plan on being involved in that effort?
The right now, I can't put a number on the number of calls we received. It's sporadic throughout the different fire departments. I know day one, as soon as they started talking about vaccine and the term Sanford being one of the ones that was going to be administering it, we started to receive a couple of calls. And so it was important that we try to get the message out that this is a tiered process. The CDC set the tiers, we didn't, but we're working best to get through that process. As far as down the road, we haven't really gotten to that point yet. We're kind of using the EMS and the fire and the 1A people as the beta testing to see how well it goes. It really comes from a power much higher than York County IMT to determine who and where and how they're going to receive vaccines for the general public. And it's going to be quite an undertaking. I know a lot of private industry has stepped up to be able to help make this available. I truly believe that we have to push this vaccine out as fast and as and efficiently as we can in order to achieve the goal of the country and reach that herd immunity of the 70% or whatever is set. If we trickle it out, we're never going to get there. So it's important that everybody participates. But that also costs money, and we have to have funding in order to make sure that's happening. So right now we're okay for funding with what we're doing within the EMS world. But when it starts happening to doing mass amounts of the general public, there's going to be a bill that has to be paid in order to get this done. And we're not sure how that's going to happen yet. So that's the best information I can give you, Deb.
Okay, thank you.
Are there any additional questions?
Is that it, Megan? No others?
Okay, back to you, Chief Gagne.
All right. Any closing remarks from any of the command staff before I end?
Scott, I'd just like to say, thank you for the opportunity for you, for us to speak to you today. It's real important that you guys work to help us get the message out that help is coming to the average person, but it's coming through a tiered process. And we hope that people stay patient, they stay safe, they continue to practice the guidelines that are put before them with proper social distancing and wearing your masks. That's going to help everybody in the end. And it's really, we still get some troubled times ahead of us. We are not beyond the rainbow yet. So, but with little help and with your messages by putting out and listening to the people who are in the know in the CDC and your local fire and EMS rescue organizations, hopefully we'll get to a better place as soon as we can. So we appreciate your help. Thank you this morning.
Nate?
I would just echo Chief Benatti's comments here and just know that we do have in York County anyway, I certainly we know that other counties are immunizing and that they may be doing things the same way or differently, but Chief Gagne is our PIO and he can help sort of redirect or answer questions throughout the process. And if you don't have his contact information, then we can certainly get that to you. But again, we appreciate the message that you guys are getting out, and we're here to help. Thanks, everybody.
So I guess I'll just close again saying thank you as well. Please reach out to me or Megan. A lot of you know Megan. Either one of us is fine. I'd rather give you as much information as I can. I know that's the right thing to do. Again, I believe in the partnership. So we'll continue down this path together. We will give you updates on what's coming on. I know we talked about a clinic or a couple in the county coming up this weekend. We haven't finalized those yet. So we'll give you some information when we have it. Again, though, we ask to respect the privacy and look at the sensitivity of this with HIPAA and other things. So as we move through this, we have security concerns and things like that. So again, I'll give you the information we can, but we also want to work with you and have you respect the privacy and things like that. So as we move forward, please reach out And anything that I can do, or I speak for Megan, Megan can speak as well, please don't hesitate. So that's all that I have. All right, if there's no further questions, I appreciate your time. We'll end this Zoom call together, and I look forward to seeing you in the future. Thank you.